Vaccines are probably the most important public health measure and most effective strategy to protect the population from COVID-19. Now, Covishield and Covaxin are the two vaccines that have been granted emergency use authorizations by the Central Drug Standard Organization in India. However, their safety isn't fully evaluated till date. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about the after effects of COVID-19 vaccination that happened in the Indian population. The efficacy of these vaccines have been evaluated, but very little is known about the adverse effects that these usually cause. Now, an Indian study evaluating the symptoms following the first dose of COVID-19 found that 65.9% of the respondents, they reported at least one post-vaccination symptom. The study that I'm talking about is published in the Journal of the Associations of Physicians of India. This study was planned to determine the incidence of adverse events experienced by the participants post their COVID-19 vaccination, and also to compare the adverse events in the participants who were receiving either Covishield or Covaxin. So, a cross-sectional questionnaire-based study carried out in persons of either gender above 18 years of age who had received at least one dose of either of these two vaccines. Information was gathered using a self-designed, pre-tested, semi-structured questionnaire. The study population consisted of around 565 participants. Covaxin was received by 128, while 437 participants had received Covishield. Now, 8% of the participants were the rural residents and 92% were the urban ones. So, the number of participants who actually experienced adverse events after their Covishield vaccination was significantly higher when compared to those who experienced adverse events after a Covaxin. So, out of the participants who reported a history of infection with COVID before vaccination, 92.5% experienced pain at the injection site, 66% experienced malaise compared to 78.3% and 46% participants who reported no history of any infection. Adverse events like malaise, fatigue, fever, body ache, headaches, joint pains and decreased appetite were all experienced by statistically significantly more participants after the first dose of vaccine than after the second dose. So therefore, the authors to conclude, higher number of participants who received Covishield, they experienced adverse events more compared to those who received Covaxin. So participants under the age of 50 experienced more adverse events. Adverse events all included like malaise, fever, body aches, headaches and insomnia were reported more by the participants who were receiving the Covishield vaccine. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.